Welcome, everyone, to In the Hot Seat. For our repeat viewers, thank you for joining again. If you're new to the show, every 2 weeks we put some industry expert or customers in the hot seat for a lively discussion, debate, maybe a little discourse as we humanize the digital experience. All aspects of the customer lifecycle are up for discussion, as well as the technologies used throughout each phase of the customer journey. This episode is the fourth in our healthcare series, and it focuses on remote monitoring, IoT, and all things healthcare data. So I'm excited about this one, Thomas. I
Oh
think it'll
yeah,
be really interesting.
it will be, especially if I'm looking at what stuff we currently carrying around with ourselves. So like
Yeah.
iWatches, or how they are actually called. I don't wear a watch, or rings.
Yeah, rings. Well, that was going to tell you about this because this is an interesting one. I switched, I watch an Apple Watch user from the beginning, and they're fine. It's interesting, and they do collect a lot of data, but they don't, show you maybe as much data or make it as actionable as perhaps you wish. And I was having some problems sleeping, so I bought this Aura ring a couple months ago, and literally the data and the way they present the data, because the app is really, really detailed and it provides a lot of visibility. With that amount of data, I've diagnosed a problem in within a week and it was a simple fix. It's just, I didn't know. And it was granular enough to do that. And then last week, I came down with the flu, so I was out for a few days. But before I actually knew for sure, I got an alert from the, in the app on the ring, and it said that my temperature was elevated and my heart rate was elevated. And lo and behold, within the next couple hours, I started to develop symptoms. So it's pretty interesting, I think.
It is, but on the other hand, there's a lot of quite sensitive data going back and forth. So in how far do we expose ourselves to, well, not so helpful services?
I don't know, Thomas. I think I sort of have taken this approach at this point because there's so much data out there and so much data
Yeah.
about me out there that I'm not sure how you
Means what
ensure
what what what
privacy.
little more can be out there. And talking about those monkeys, well, at least we are talking about it.
Well, I mean, that's fair. That's fair. I
Yeah.
I I don't know. I mean, I think at some point, I think we've given up a certain amount of privacy, and I guess the degree of that, although not necessarily just in your hands, but the degree of that is something that you have to monitor, I suppose.
Yeah. Is it a good business case to combine this with insurance data?
Well, that's an interesting question, and I've heard both and honestly, I mean, if you're talking about data and insurance, the one that I've particularly resisted, and I hope my insurance company isn't listening, is the idea that it can monitor your speed and braking and that sort of thing, because I do not want that. I am not participating in that program.
So long as you are not running a GM car.
Yeah, well, yeah, that's true. Yeah, fair. But I mean that's a great question. I mean, is it, where does the data go and what use is it? And I mean, I could
Yeah,
see sharing this with a healthcare provider. I think that would make a lot of sense. Sharing it with
yeah.
your insurance provider, I'm not
Makes a
so
lot of
sure
sense
about
for
that.
them.
I mean, I guess it depends on how good the data is. Maybe I don't know.
Yeah, but if the data is not good, it doesn't help with the healthcare provider either.
Well, that's fair. Yeah, that's
Yeah,
fair. I mean, it does come back to data quality
yeah,
in both applications. One of them perhaps financially less
yeah,
advantageous than the other,
yeah,
but
yeah. How about more intense applications like monitoring of a cardio booster, for example?
hmm,
If you have a an built-in CPR
mhm.
system that keeps your heart up and running, that probably wants to get monitored as well. So, are you aware of any solutions there? This
I
might be.
mean, I definitely have heard about, and I'm sure we'll learn something about that from our
Yeah,
guests. But I've heard about stuff like that, and the idea that you can start to monitor in real time certain things. Are actually even one I saw recently, because I have my mother's 88, so getting up there
mhm,
and
yeah,
certainly lives by herself. I worry about falls. And there was a solution I saw that basically builds a profile of your house and can detect falls using a type of radar or lidar. I forget which one,
Mm,
but and so rather than having, because sometimes older people have slow falls, right?
mm,
It's not a
yeah,
catastrophic fall.
yeah,
It's a slow that perhaps a watch or a ring or something like that wouldn't necessarily pick up, but this
yeah.
would, because it can see the actual person and where they are in relation to the rest of the house.
Mm,
So I mean, to me, that seemed like a pretty good idea.
yeah, pretty much, yeah.
Yeah.
So let's ask an expert, right? So we are
Yeah, I think
kind of
we can sit
theorizing
here and make
around.
stuff up all day long, but maybe we should bring Drew in. So
Yeah,
I'm really excited to welcome Drew. He's a co-founder and CEO of Validic, the leading digital health platform for personal health data. Drew's a ex officio board chair of the Customer Technology Association Health Division, a member of the CTA Executive Board, Board of Industry Leaders. He also helped advance the industry through CTA policy efforts and involvement with the CTA Health Standards Subdivision. Drew's also a member of the Highmark Health Technology Advisory Group. He previously served on the executive committee and board of North Carolina Council for Entrepreneurial Development. Served as the board member. He's been on a lot of boards. Board member for Executives for Health Innovation, team member Clinical Trials Transformation Institute, project advancing the use of mobile technologies for data capture. So definitely well qualified. He lives now in Chapel Hill, North Carolina, with his wife, two sons, family, the family dog. I have that too. So I appreciate that,
who
and enjoys
doesn't?
design, technology, good beer. Again, we have that in common. Great food and some coffee, which that's a necessity. Welcome, Drew.
Welcome, welcome. And that's directly, we had a bunch of different systems that we just briefly touched in the minutes before we brought you in. And it seems to me that they are all disconnected. So Apple has their own data store, the O-ring has its data store, then we have the slow fall detection ability that has their own data store. So this is all siloed data. How can this be brought together somehow? Is anybody interested in bringing that together somehow for better customer patient experience?
Yeah. Yeah, absolutely. Well, and thank you guys. Really excited to be here. And by the way, if you hear my dog, he's actually laying right on the floor behind me. So
Mine's about 5 feet over that way. So
Yeah.
same.
Mine is there.
Oh, that's great. That's great.
Nice.
Yeah, no, it's a great question, Thomas and Micheal. Thank you for that introduction. We do have tons of personal data that we're capturing and creating in our daily lives every day. And, I think one of the things that, Micheal, you mentioned that, like you were discussing how do we share this data? And I think it's pretty clear that we as people don't really have a sharing problem. Like if you think about what people are sharing on, TikTok and Instagram and X and Facebook every single day. I think that really the challenge that we have is we don't really have a reason to always share it with healthcare. And it's because healthcare hasn't given us a good reason to do so. But what we find, so at Validic, we have the largest health IoT platform. So we connect data from 600 sources, everything from, wearables to in-home blood pressure monitors, weight scales, glucose meters, CGM, thermometers, all that stuff. And what we find is that when health systems are able to create a program of care for their patients or members, where their clinicians are able to discuss with the patient, hey, here's the thing that we're trying to help you with in your health. And this data is going to help us do that. And the patient understands their role in the program. The clinical team explains what's going to happen. All of a sudden now it's a team-based care approach. And it's not just like, hey, go off and do something and then come back and tell us how it worked, right? Which is kind of how healthcare has worked in the past. It's this is the program of care that we're going to talk about, and here's how the personal data helps us. And so, as a real life example of how this has worked in the past, there's a gentleman by the name of Steve who we worked with a number of years ago, and he had before we were working with him, he had uncontrolled diabetes for over a decade. And he'd go into his endocrinology appointment, every 3 to 6 months, and his A1C was always extremely high. He's trying to take his medications regularly, but it wasn't really working. His doctor would say, you need to exercise more, you need to eat healthy. And he was trying to do that, but just nothing was working. And he was even taking his blood glucose because that's what he was told he should do. And so he would actually bring his glucose reading, his glucose report, into the doctor. And the doctor would be like, I don't really know what to do with this data, but I'm looking at your A1C, it's not working. So just try harder, right? And so Steve got really frustrated. He actually ended up having to quit his full-time job because he was too exhausted to make it through a whole day. It was a really bad situation. He was really having a pretty poor quality of life at this point. And so he left that endocrinologist and actually went to a different health system that Validic was working with, where we were able to bring people's data from their personal health devices into the EHR clinical workflow. And so at Steve's first appointment, he hooked up his glucose meter via an app that would bring the data into the clinical workflow. And the nurse explained the program of care and how it worked, which is basically, hey, look, you do your thing, and we're just, the system's going to remind you to take a reading if you forget, and then the next time you come in for a visit, we'll have your data before we see you, and so we'll know what to talk about. So at Steve's next appointment, he goes in, and the diabetes educator looks at his data and says, hey, so looks like you're tracking really regularly, which is great, but what's going on between 7 and 9 p.m. at night? Because your glucose levels are always higher in the evenings before you go to bed. And he's like, nothing. And she's like, well, are you eating anything? He's like, well, I mean, I'm watching Netflix with my family. We're having some popcorn, but it's healthy. It's like non-butter, non-salt, like fat-free, 0-calorie popcorn. And she's like, maybe try cutting that out. So he cut that out. Within 30 days, his A1C dropped by 0.5 point. It's the first time he'd ever had a behavioral intervention that led to a meaningful drop in A1C. And from that, it led to an ongoing series of discussions with his doctors, where every single time he was looking at his days, looking at his numbers, he was seeing, hey, there's something going on here, and changing his diet and his activity based on that. And, over the course of several years, Steve's now lost 50 pounds. His A1C went from over 9 to now it's below 6. He's organic gardening. He's working again. I mean, he's loving his life, and he really credits the data. And, what was the doctor doing differently, right? The doctor was still trying to educate them, or still trying to educate them, still trying to understand what's happening, but it was just using real data. So now it wasn't about, you need to eat healthier and exercise more. It was like, I actually can help you target what healthy means for you, because we have the data to have the right conversation. So I think that's where personal health data can really make an impact on people's lives.
I mean, that personalized experience, right? I mean, so rather than a generic eat better, you get a don't eat the popcorn between 8 and 9 o'clock every night. That's amazing. Right. Well, Thomas, I get to jump in here because you know what next question is going to be. I always get to be the AI questioner. So I'm curious now, we have all this data. We also have, as we know, some really interesting technology. Some's been around a while, some new around AI and generative AI. So I'm curious, what are you seeing around the use of that data, and how perhaps generative AI and AI could be used to make the experience better from beginning to end for both the patient and the provider?
Yeah, absolutely. I mean, from a patient perspective, I think the real advantage of using Gen AI is that you're able to summarize some pretty complex medical things in relatively easy to understand terms, right? And I think the risk there is that Gen AI is not always right, but for most straightforward things, it's pretty good. And I think it is a really good patient education opportunity for people to better self-educate themselves. Where I think that Gen AI cannot play today is it cannot play in medical device, like actual medical opinions. There's no room in medical opinions for hallucinations, whether that be a human or a bot. Right. So if you had a doctor who is hallucinating, you should be concerned, and you should be concerned if your bot is hallucinating as well. So I think that's where it's not ready for prime time, and probably won't be for quite some time. Where I think on the provider side, where I think there's some really interesting opportunities, is that there are very rote tasks of just communicating with people around checking in, how are they doing, you know, and like you can do some surveys, like that's okay, you know, filling out an app, but you can also use a Gen AI virtual assistants that sound like a person. They're much more conversational. And honestly, it's a better interface even as a human to be responding. But it's using a bot and not a person. And if they're, so it can call and say, hey, how are you doing? Notice you haven't been checking your readings, or notice you haven't been doing this. Do you have any questions? Or, you know, since the last time we spoke, are there any updates to your, you know, whatever, your address, your phone number, whatever. All these questions that typically require staff or clinical resources that are basic just information gathering can be done with Gen AI. And I think that's a huge opportunity to have an inflection of productivity, where now you have, you know, your people focused on things that only people can do. And the bots can do things that are more routine tasks. I think we're going to see a lot more of that before we ever get into the clinical evidence and medical delivery.
Let's dig a little deeper into that one, because I mean, there are plenty of situations, plenty of cases where people go from one doctor to another just to get another diagnosis, which means one of the two doctors probably had a hallucination, or at least a bias, at least a bias. Yeah? So, and that, combining that with the example of the example that you just had, there's this spike between 7 and 9 p.m. always, every day. So why isn't that some data, or was that some data that is also shown to the patient, to the person? Because then they can get their own thought process, or the question that the nurse asked is, what the heck are you doing at 7 p.m. besides watching Netflix, is something that he probably could have asked himself.
Interesting.
Yeah, so I think that this is where consumer health devices and technologies have a really big opportunity. So if you think about, Michael, to your point that you mentioned at the top of the show with the Oura Ring, giving you insights about, hey, you know, here's some areas that can improve your sleep, or hey, you might want to be paying attention to your health because your temperature is raising. Those are really important insights that need to be surfaced, or can be surfaced to the benefit of consumers. Another great example of this is OneDrop for diabetic patients, which has a really, really engaging consumer technology-driven coach. You know, I call it AI. A lot of some of it is ML, not all of it is AI. But it's a really, really tech-forward coach that helps people understand and surface these insights in ways that they can start to improve their own health. And I'll say that, unfortunately, not all health devices have yet gotten to that point. My Apple Watch, for example, I use it for my sleep. I mostly use it because I actually use it for running and tracking all that. The downside is, when I have poor sleep, my Apple Watch never says, it just tells me I had poor sleep. It doesn't draw any conclusion or comparison or anything into why that might have happened. Like, your stress levels were higher on this day, and then that night you slept poorly. Like, it does, you know, I know that it's, you know, because I had a board meeting, but my Apple Watch doesn't give me any insight into why, you know, what I might do for next time. Right.
Yeah. And that's actually what I switched away from, because of the same thing. Like, for several years, I've been trying to track sleep data with the watch, and it does collect a lot of things, but it doesn't connect things very well, nor does it give me the display of the data in a way that made me able to analyze it in some, you know, useful fashion. But the Ring was, because of the, I mean, I guess they both probably collect the same data, but the Ring, because of the app and its ability to help me analyze that data, really works well. So that's an interesting point.
I'll give you another really, really interesting one that came up from a panel that I hosted during CES this year in Las Vegas. And Dr. Ami Bhatt with the American College of Cardiology had mentioned a really interesting use case for AI, which is, look, especially with consumer health data, we definitely do not want AI making medical recommendations that are, you know, that have the stamp of a health system or a health plan or anything like on it, right? But could we instead use that data to help to help better prioritize where a provider should be spending their time. So in other words, if you have a nurse making their rounds on the floor or making phone calls out to patients, as it is, they probably just go straight through a triage list in the order that those patients are listed, however they're listed, right? By admit date, by alphabetically, by birth date, who knows, right? But instead of prioritizing it randomly, why don't you prioritize it explicitly using the AI to say, hey, based on the data, this person probably needs to have a conversation more than others, right? And so prioritize that person at the top of the list. And that could be used same for, radiology scans. We know that that AI does amazing things in radiology. It's not yet to the point where it should be the sole basis of a diagnosis. But if you have a patient, who has a really, really severe acute issue, and they're at the bottom of your list, it might be that hours matter, and you have, a radiologist reviewing this report, and they're not going to get to that one until 3 or 4 hours from now. Whereas using an AI based ordering system, you could actually put that at the top. The radiologist sees it when they're fresh. The patient gets more timely intervention. And I think that that's an opportunity for AI that I'm not really seeing a lot of yet, but I think could really make a big impact in healthcare.
Which brings another interesting avenue that we may or may not pursue, because I'm a German, so there is a public and a private healthcare system. So now, and guess what? The privately insured ones pay more. Surprise, surprise, yeah. So now the one that should be top on the list is unluckily a publicly insured person. So from a business point of view, why should I treat him first? We are getting deep into ethics there.
Yeah, I mean, look, I do not know a single healthcare provider, physician, who would say that they would treat anybody differently. Everybody who I know, they don't care what the insurance is, they care who the people are. And when I talk with health system executives about this basic point, they say the same thing. We want to treat everybody the same. There are really where I think it gets really interesting. I don't think it's necessarily in the reimbursement rate that gets interesting, Thomas. I think where it gets really interesting is when you have people who are in a value-based contracting arrangement versus when you have people in a fee-for-service based arrangement. Because in the value-based arrangement, the opportunity for that health system to capture revenue is actually to limit the number of interactions and try to get that person to the lowest possible cost of care as quickly as possible. Whereas with a fee-for-service interaction, saying, you know what, why don't you try this and come back in 2 weeks, and we'll see. That's just another billing. Do they need to be seen in another 2 weeks? Probably not, right? Or maybe not, right? Maybe they do, maybe they don't. But in a value-based arrangement, I guarantee you there's some way to check in to see if they actually need to come in for that appointment in 2 weeks versus the fee-for-service. Like, no, I'm going to just schedule it now. You're coming in 2 weeks. And I think that's where things get really interesting in the US. Mostly. It's less about public versus private and more on the shift to value.
Which is a good thing to go for. So how can that be combined with data providing systems like Mike's Ring or whatever? I mean, a slow fall system or whatever other parts that we have, connect my Peloton to it as well, which I may or may not use on a regular basis.
Yeah, totally. I think that there's a few different opportunities here. One is that on the we'll call it the fitness side of things. So mostly what you do with your wearables, certainly what you do with your Peloton, the fact that after this I'm going to my gym. I think that type of health engagement and proactive health type of data it's good for us as people to capture. I think it is medically adjacent information. Like, would I like my doctor to know that I do that stuff? Absolutely. I would love for them to know it. Is there necessarily any medical decisions to be driven from it? Not really. And so a lot of the programs we see around this are programs with, health plans. So, we work with CVS Health and Elevance and Cigna, organizations like that around engaging people, healthy people in healthy activities so they stay healthy and engaged longer. We also work with AARP, and they engage their members with wearable devices really for brain health and longevity, because there's a direct correlation between activity levels, your healthy activity, and increased brain function as you age. And so that's how they really look at this. So that's where I think the more health and fitness data comes in. Yeah. On the healthcare side, I think there's actually, from a value perspective, massive cost saving opportunities. Yeah. Because every single organization that has care managers who are calling and checking in on people, these are the people who call and say, hey, don't forget about your annual flu shot. Hey, don't forget about your annual wellness checkup. These things, right? They are also calling people who are, who've been discharged from a heart failure episode, or who have had some other acute condition and they need to follow up and just check in and see how they're doing, because they want to avoid admissions, readmissions, ED visits, things like that. And oftentimes those care managers are calling and they're not able to get people on the phone, or when they are able to get people on the phone, it's like there's nothing really to discuss. There's not a major item to discuss. And so it's a lot of just kind of picking up the phone and dialing. And with data, when you add data into that equation, what we see with our clients is they become much more effective and efficient with their time. And so, we work with IDNs and organizations that have a lot of value-based care providers. And, a couple of examples here. One is that for one of our clients, the average call time that clinicians would spend on the phone with patients dropped from 15 minutes on average down to 5.5 minutes on average, because they knew exactly what the phone call was going to be. They knew exactly what questions to ask. Like, the patient got better, more direct questions. They got off the phone sooner, like way better patient experience, and a huge cost saving or huge time savings for the provider. Another example is with a cardiac clinic that we were working with, where they were doing patient evaluations to prevent readmissions. And the nurse care team could do about 6 evaluations in an hour. And once they added getting the Validic data into the system, this was blood pressure, weight, and pulse oximetry data. Once they were able to get the data into their EHR, they were able to go from, same care team, they were able to go from 6 evaluations to 20 evaluations in an hour. So they could get done in about 2 hours, what used to take them a whole day. And they actually had better clinical results. So the patients weren't bothered as often as they needed to be. The clinicians were much more effective, and they had better clinical results, just because there was real-time data coming in and they knew what the conversation was going to be. Like, data really, I sometimes I'll say to my team when they're like, do you want to hear this bit of news I have? And I'm like, sunlight is the best disinfectant. Like, give me the data, tell me what's going on. Like, I need to know, right? And like, it's the same for healthcare. Like, I'm not saying like we always need more data, but having the data in the right area for the right purpose at the right time in the right way is hugely valuable for clinicians and drives a ton of efficiency.
Well, what about tying that in to the actual care delivery itself? So, like, remote monitoring in the midst of some illness episodes, whatever that might be. I mean, how does that tie in? And then, is there some role you see in AI technology perhaps playing a part in that, from a predictive perspective, or even like, the idea of mobile devices, mobile technology, that sort of thing?
Yeah, totally. Yeah. So remote monitoring is a use case of personal health data. And I always drive, we actually just last week were named the best remote patient monitoring solution by the MedTech Breakthrough Awards, which is great. But it is a use case for what we can do with personal health data. It's not the whole platform. And when I say use case, what I mean by that is remote patient monitoring. So like, it is an inherently invasive term.
Yeah.
Right.
Yeah.
You are monitoring a person. And so I think there are real use cases where that matters greatly. And so think about, if you are being monitored in a hospital bed, would you rather be in that hospital bed being monitored, or would you be more comfortable in your home being monitored? Most people would say the home, right? So early discharge from the hospital to the home to follow that person for a few extra days with some real healthy information, so you can know if that person needs to be brought in or not. They're continuing their recovery well. That is a great use case for remote patient monitoring. An example of that is my grandfather, who's about to turn 94 in a month. When he was 90, when COVID hit, and he his first case of COVID was when he fell down the stairs and had to get admitted with a punctured lung and some broken ribs. He fell down the stairs, by the way, moving an exercise bike down the stairs by himself because he wanted to move his exercise bike. He's a healthy guy. And so while he was in the hospital, he went to a rehab facility and he got COVID in the rehab facility, versus if they were able to just send him home with some devices to continue to monitor his progress, he would have been able to recover there and not been exposed to other things, which is, you know, a lot of people get sick in these facilities, right? Another example is when you have someone or you have a bundled case or some sort of model where you need to make sure somebody doesn't get readmitted post-surgery, right? And so that readmission example is someplace, you know, heart failure is a very classic one where you want to follow that person and make sure that they're not getting admitted. The AI use case for those specific remote patient monitoring things is the follow-ups. So if you could have, you know, an automated virtual care manager reach out and say, hey, you know, do you have any, we see your data, do you have any questions, and ask some pretty routine questions as a follow-up to see if they need to speak with someone else, and then surface that up to a nurse if they need if they have a clinical question. I think that's where there's a real opportunity for those automated assistants. And the last thing I'll say on this point is that a lot of people think about remote patient monitoring for like diabetes, hypertension, weight management, things like that. And I'll just say, like, it's a bit overkill. Like, unless you have a diabetic patient who is, you know, has an A1C that's, you know, greater than 9.5 and is really, really struggling, you know, for a period of time until they start to bring down their A1C, you might need an acute remote patient monitoring program for them. But once they're starting to normalize, like, just bringing in their data is helpful. You don't need the monitoring aspects. And similar with hypertension, if you have someone with, you know, really severe hypertension, until they get their meds locked in, maybe you want to follow them a little bit more closely. But once their meds are locked in and their blood pressure is starting to come under control and they're getting their routine down and they're still taking their blood, like, it's good to have their blood pressure data still come in, but you don't need the active monitoring portion. I feel like that's like a big misconception in this space, is like everything with personal health data is remote patient monitoring. And that's not the case. Like, sometimes just better data is helpful for the patient and helpful for the care team, but it's not monitoring in a.
So it sounds like it's the value of the use of the equipment in the certain situation, right? If it's really valuable, that makes sense. But then if there's not an immediate value to the remoteness of it, you know, in real time, then there's probably no reason to do that.
To do it
That
at
makes
all,
sense. Yeah, that makes sense.
But looking at it from the other side, this is a really good question that Stephen here has.
Yeah.
So it's not only useful for the provider, but hey, why should I trust into this system?
Yeah, so it's a great question. So the question is, like, what affects people's trust in the security of the device? And I'll say that the short answer is there's not a lot to go on right now. And, you know, I think that's one reason why companies like Fitbit, that have been around for a long time, are really trustworthy. Apple, I think, has a really trustworthy brand, right? I think that's where a lot of people are gravitating toward. But today, industry has not given us a lot to trust. I'd say or a lot to base our trust on. I'd say anything that is FDA listed has gone through a certain level of security and a certain rigor around their data. But it still doesn't answer the cybersecurity questions, which I think is where the question's coming from. Yeah. So I'll just say that the federal government right now is working. You probably haven't heard about this, but the federal government right now is working on a new cybersecurity seal, a cybersecurity trust seal for all technology-enabled manufactured products. And what they're really hoping for, and I know they'd like to pilot it by the end of this year. I don't know if that's going to happen, but what they're really hoping for is that this is sort of serves almost like as an Energy Star type of seal, where if you have a product that has this cybersecurity trust mark on it, then you know that it's met at least a certain baseline of protecting your privacy and security concerns, and that they won't use your data in certain ways, the data is protected in certain ways, and all this. And so I think that's where the industry is shifting toward. We don't yet have that today, but that's where the industry is certainly heading, which I think is a really positive thing for everybody.
Yeah, that's interesting. The other thing that kind of comes to mind when I think about this remote monitoring situation, and I do some work with an IoT startup in a different application of it, not in a healthcare application, but it is definitely something we've had conversations about what does the infrastructure need to look like to collect that data and transmit the data, and how do you ensure data at rest and data in motion are particularly protected somehow.
Yeah, totally. So, I mean, that's really what my company does, right? So
Well,
we
there you go, softball.
Yeah, I mean, we launched the company in 2013 as kind of the category creating health IoT platform, and our initial focus was on the consumer health devices, so wearables and health apps, things like that. And we were actually scratching our own itch. We were solving a problem that we had, which is we were building a larger engagement platform, and we needed data from all these devices. And we realized there was no place that we could get it. We had to build it ourselves. And it was really hard to do. And so we started to say, hey, what if this was something we could just do for everybody else? But, we have everything that we do is fully encrypted in transit and at rest. The data that moves through our health IoT platform specifically is actually de-identified. So we don't actually know who that person is. It's tokened on either side, and our clients can re-identify on their side. And then the evolution of that, which was a pretty natural evolution for us about 6 years ago or so, was to say, hey, we get a lot of asks from clinical teams to use this data for healthcare, but they don't have the ability to get this into their EHR. And so what we did was we extended that IoT capabilities with the few things you need to bring the data into the EMR. So that means enrolling the patient into a program in the patient chart, surfacing alerts or notifications via the in-basket or in-basket pools, visually integrating. We're writing the data directly into flow sheets. So all of the things that you can do with normal health data in the EMR, you can do with our solution.
Yeah. There is an interesting discussion going on in LinkedIn here right now. So when it comes to distrust, which is probably the most interesting topic in general, or trust, positively, of course, would like my doc know about my situation. As Mike and I already slightly put it, we are not so happy with having the insurer having the same data. On the other hand, someone will need to foot the bill of the conversation I had with the doc, or the avoidance of having it with the dog, because the AI is already working on helping me, because it's interpreting the data that the device collects, and that vendor will want to be paid as well. So we are in the conglomerate of healthcare provider, tech providers, and insurance providers, who all have their own interest as well. So how is it possible to navigate this scenario, apart from hyper, that may or may not work, in a way that I do believe that all these providers, of which I trust the doc probably most, are working in my interest?
Yeah,
and not just increasing my insurance rate.
Yeah. Well, so a couple of things on this. Like, probably first on the insurance side, I will say don't give payers too much credit I do not think they are going to be able to adjust your rates at an truly individual level. Like they are looking at the data from a much higher risk perspective. And I do not think their actuaries right now are in any way, shape, or form making estimations on your own personal plan. And especially if you get your insurance through an employer, it's definitely like those are group level decisions based on statistics across many, many employers. If you get your insurance through CMS, that is also group level decisions. And if you get your insurance through the exchanges, it's much more demographic focused and your own personal health history from surgeries and other like surgery, cancer, things like that. That's where most of the risk is coming from. It's not coming from your Fitbit data, et cetera. You're more likely to get dinged because you have diabetes than because you walk less than 5,000 steps a day, right? So I think that's really, it's more condition focused as opposed to activity focused from the payer side. And from the device side, I actually think that the health devices, the consumer health devices, are more incentivized than ever to protect your data because they are like there's such a scrutiny around like the sale of data. I think the reputation damage to a device that was found doing unscrupulous things with data is far, far higher than any benefit that they would get from a monetization perspective at doing anything. And I think that most device company, every device company I've talked to about how they're thinking about their data, they're all using it for their own systems improvement and things like that. And then if there are studies or, whether they're clinical trials or whether it's trial recruitment or whether it's some sort of public health initiative, those are all opt-in opportunities that they bring to their members, specifically separate from the general opt-in. So that's where I see it. And from the healthcare provider side, I think you're right. Like that's where there is, generally speaking, some real virtuousness. And I think that's where the value-based care contracts in particular start to really win out.
Okay, so taking the insurers out of the equation again, but you say the vendors particularly are highly incentivized for keeping the data secure. So still we hear more than every now and then about a data breach exactly in that area. Yeah. So is this because we're oversensitive or because it just happens more often because this is interesting data? What do you tell, patients or non-patients? Ask.
Yeah, well, so just to be really clear, like what they want, mostly what they want is credit card information. Right. Like, okay. So that's what they're really looking for. Like your blood pressure values or your CGM values or whatever the case may be, your sleep and running data is not that important to a hacker. Like, I mean, I don't know what possibly they could do with it that would be of that much value. What they're really looking for is credit card information. And that's, it's not the unfortunate reality that we live in, is that there are a lot of people trying to get access to any type of, demographic and credit card information they possibly can to create a better asset that can sell on the dark web. Like that's just the reality of it. And I should say that Validic does not have any credit card information on any person. So if anybody's looking at us, just
so no need to look there. No need
to de-identified blood pressure values. Not much there.
My BMI is not interested.
Yeah, no, probably not. Like, so Drew, I'm curious about one thing in all this, because we've been talking about the remote monitoring, creating a lot of data. We've got all these consumer devices, data, right? But we didn't really talk much about the other end of this, the provider side of this. I mean, that's a lot of data. What kind of impact is that on the healthcare provider themselves in trying to consume this, use it, interpret it? What does that do from their perspective?
Yeah, totally. So I'll give you a story. So there's a gentleman in a physician in California who he prescribes his patients, his type 1 patients mostly, increasingly his type 2 patients, Dexcom CGM. And there's no way for him to get that CGM data into his EMR. So what he does is Dexcom has like a friends and family sort of sharing option where you can share with your caregivers. So he asks his patient, hey, add my email to this caregiver thing. And so at night he goes home and he opens up his personal laptop and he signs into Dexcom. And then he opens up his work laptop and he signs into Epic, and he reads through all of the Dexcom reports from all of his patients, and then types clinic notes into his and messages to his patients in Epic. Like, that's kind of the current state of affairs for physicians who really want to use this type of data. And it's obviously, like, first of all, that physician is superhuman, and that's just not going to scale. And second, like, it just goes to show you that the data can be really valuable. And so what we see for our clients, unfortunately, his health system's not a client. What we see from our clients who have the data in the EMR is that 9 out of 10 physicians say that the program saves them time. 9 out of 10 physicians say they feel like they're delivering better care. And the reason is because they have accurate, timely data in the clinical workflow. And the point is they see the data when they look at the patient chart and when they want to see the data. If it's a specific monitoring program where notifications are surfaced up via the in-basket or in-basket pools for a care team, those are notifications that are not like FYI about the data. Those are like, oh my gosh, I am so glad I had this notification, right? It's like, I would tell somebody, if you're getting if doctors are complaining about they're getting too many notifications, you've done it wrong. Like, every single notification they should be like, thank goodness I got this notification because I want to talk to this patient about it, right? And so that's really where it comes in is the data is more valuable to enhance the experience when the doctor is actually talking with the patient, as opposed to, like, the doctor, there's like these views of like what the future of virtual care looks like, with like doctors standing in front of a panel with all these like graphs, and they're like, like looking out at the patient population as if it's some like, thing that's rapidly evolving, and they're making some grand decision on an individual basis based on all this. Like, it's not like that at all. It's really just, it's really just instructive and informative for the clinical teams to have a more informed conversation with the patient when they're there. And then if there is something important to know ahead of time, for those few programs where that matters, then just surface up the right data at the right time and do it in the way that the clinicians are already used to receiving those notifications.
So,
that makes sense.
Drew, we are already seriously in overtime. So, and looking at all these this exciting discussion is really exciting. So you did not only survive the hot seat, I think, but you earned yourself the right to get the heat again.
That sounds great. I love it.
So I think we really should continue this sooner rather than later, and I think all of our guests will agree to that. So thanks a lot for this one, and let's make up heat 2 for all the other ones. For our guests, thanks for being here. And if you think you have what it takes to be in the hot seat and get heated up, then by all means let us know. Till then, thanks for being here. I'm Thomas Wieberneit.
And I'm Micheal Fauscette. Tune in next time for different people, different faces, different topics, and some different perspectives as we put somebody different, or actually maybe somebody that we've already seen in the hot seat.